What's new about goniotomy with KDB? As we know, goniotomy has been around for a long time, and that's part of the reason why it has universal reimbursement coverage, and so it is a procedure that's been around for a while. But this is definitely different than what's been done in the past. I took over my father's practice. He's an ophthalmologist, and his go-to procedure for glaucoma and cataract surgery was goniotomy, and he did a lot of goniotomy back in the day. And I see some of those patients coming back now, and some have continued to do well, but some have scarred down. And I think that's what a lot of people think of with goniotomy, that you may get regression as those leaflets of the trabecular meshwork close down and scar over time, and you may get loss of effect. With a goniotomy with KDB, the dual blade removes that tissue, and you don't get that scarring effect, and you don't get that loss of effect over time. So it truly is a new procedure that doesn't have that regression, and so it's not really what people think of with goniotomy. It's definitely, with KDB, it's a new procedure. So people ask, what's different about goniotomy with KDB? And as we know, goniotomy is an established procedure. It's been done for years, and that's partially the reason why it has this universal reimbursement, is that the insurance carriers are used to that code, and so it's an established procedure. But the KDB does offer, it's a new tool to this established procedure. And what the tool does is it removes that tissue and basically prevents that regression or loss of effect that we saw with the original procedure. If you're just making an incision into the trabecular meshwork, those leaflets close, and you can get loss of effect or regression. With goniotomy with KDB, you remove that tissue and thus prevent that loss of effect or that regression. My practice, my father is an ophthalmologist, and he's now retired, but his go-to procedure for glaucoma and cataract surgery was goniotomy, so he did a number of those cases. We see some of those cases coming back now, and what's interesting, some continue to do well, but some did have that loss of effect from that scarring of the leaflets, and now with goniotomy with KDB, it's this new tool that's basically removing that tissue and thus preventing that regression that we see with the traditional or established goniotomy.